Thank you for listening to Depictions Media Radio. Welcome back to Depictions Media Radio. I am your host, Michael Clogs. In a virtual news conference, the Prime Minister Justin Trudeau addresses Canadians on COVID-19 situation. He announced the federal government is temporarily expanding eligibility for the Canada Worker Lockdown Benefit. The local lockdown benefit program amid the implementation of new restrictions across the country. He also announced that 3 members of his staff and 3 members of his security detail have been tested positive for COVID-19, but he says so far he is tested negative. The Prime Minister is joined by the federal ministers Chrystia Freeland, Jean-Yves Duclos, Carla Qualtrough. Also taking part in the news conference is Dr. Tam and Canada's Chief Health Officer, Dr. Njoo, the Deputy Chief Public Health Officer, who will provide an update on COVID-19 and the Omicron variant. As you know, in British Columbia, that they have asked that we curb our Christmas celebrations with our family, trying to keep them only to meeting in person with those who have been vaccinated, and that they have also closed down health clubs, bars, and other venues like that. So let's listen to what was actually said in this particular press conference recorded earlier December 22nd.
Thank you very much. Good morning, everyone. We're joined virtually by Ministers Freeland, Qualtrough, Duclos, as well as Dr. Tam and Dr. Njoo. We're here today to talk about what we're doing to support workers and businesses and keep people safe. Before I get started, I just spoke with the 2 new leaders of Chile and Germany, both progressive leaders, where we talked about climate change, growing the middle class, trade and youth, protecting democracy, and of course, how we're all going to work together to get through this COVID pandemic. À quelques jours de Noël, je sais que beaucoup sont inquiets. Comme depuis le début de la pandémie, on sera là pour vous. Aujourd'hui, on adapte nos mesures de soutien pour s'assurer que personne soit laissé pour compte. We made a promise at the beginning of the pandemic to have everyone's backs, as long as it took, as much as it took. That was the right thing, not just to help minimize the impact of the health crisis, but also to ensure that our economy could handle the shocks that this crisis is facing. And that's, unfortunately, what we're going to be continuing to do right now. I say unfortunately because, of course, nobody wants to be in the middle of an Omicron wave right now, but we are. So we are announcing today that we're temporarily expanding eligibility for key programs. For the Canada Worker Lockdown Benefit and the Local Lockdown Program, you'll be able to apply if you're subject to capacity limiting restrictions. The Deputy Prime Minister will have the details, but here's the bottom line. We need to, all of us, do what it takes so Canadians are protected and to have what you need to weather the storm. We're going to be there for the hard-hit regions, for specific sectors like art and culture, hospitality, and tourism. We will be there to keep you and your family safe. We're going to continue to work closely with the provinces and territories, but we will be there with supports for the areas that need it. Notre priorité, c'est que les hôpitaux ne débordent pas. Avec plus de 80% des gens pleinement vaccinés, vous avez fait la bonne chose et vos efforts aident. Ceux qui ne sont pas encore vaccinés, allez-y. Et par rapport au booster, sachez, on a assez de doses de rappel pour tous les Canadiens qui sont admissibles. Alors, allez-y dès que c'est votre tour. On sait que ces doses de rappel vont aider. Get your booster shots. We have enough in the country for everyone who needs it. So please go get those booster shots. They give you extra protection against Omicron and in keeping us all safe. Pediatric vaccines continue to roll out. Get our kids vaccinated as well. It's going to be really, really important that we do everything we can to get through this. We know that rapid tests are a part of the solution as well. We've delivered about 85 million rapid tests up until the month of December to provinces and territories. Just this month in December, we're delivering about 35 million rapid tests to provinces and territories, and we've got tens and tens of millions more rapid tests arriving in the coming weeks into the new year. So provinces and territories will have the supplies necessary to get them into people's hands. We need to follow public health guidelines to keep loved ones safe and to support our healthcare workers. I know people are tired. People don't want to be in this Omicron situation. I get it. None of us want to be here. We're tired of COVID. We want it to just go away. But we know it's not going to just go away unless we all do our part. Particularly when you think of how tired you are, how weary you are of having to deal with this COVID crisis that continues to go on and on and on. Know that there are people more tired than you. Know that our healthcare workers haven't had much of a break over the past 2 years, that they've been going flat out, keeping people safe, working in long-term care homes, working in hospitals and clinics, administering vaccines and boosters. Our frontline health workers have been extraordinary heroes. They have been there for us every step of the way, and now we need to be there for them. We need to prevent Omicron from overwhelming our healthcare systems. In order to do that, we have to keep contacts low. We have to make choices that are going to keep us and our families safe because Omicron is out there. And the way we show our support for those people who've been keeping us safe is by making sure they don't get overloaded this winter. We know this variant is spreading very quickly around the world, around the country, and indeed around our own communities and offices. My office is not immune. We have 3 members of my staff and 3 members of my security detail who've tested positive. They're following all public health guidance. So am I, and so must we all. But it's a reminder that the virus is all around us. It's very much a threat. We have to keep our guard up. À Noël, je sais qu'il y a des gens qui vont pas pouvoir se rassembler comme ils l'auraient voulu. Pour ma part, j'ai hâte de passer du temps de qualité avec ma famille proche, mais il n'y aura pas de party ou de rassemblement. C'est la réalité à laquelle nous faisons tous face. The thing is, though, we know what works. Canadians have shown over the past 2 years that we're able to step up for each other, that we are there for each other. We know what to do. We know how to wear masks. We know how to keep our distances. We know how to reduce our contact numbers. And if we do that well over the next couple of weeks, we're going to see a better winter and especially a better spring than otherwise. I know nobody wants to be in this situation right now, but Canadians have shown that we're there for our neighbors. We're there for our most vulnerable. We're there for our frontline health workers. We have vaccines. We have PPE. We have rapid tests. We know what to do. We're going to do it because that's who we are as Canadians. We stick up for each other. We make those tough choices to keep each other safe. And we know that as long and dark as winters can be, spring is coming and spring will be better if we hunker down in the coming weeks. Merci beaucoup, mes chers amis. Je passe maintenant la parole à la vice-première ministre Freeland. Chrystia, go ahead.
OK. Merci, Monsieur le Premier ministre. Bonjour tout le monde. Dans les derniers jours, nous avons constaté une montée des cas de COVID-19. certaines régions du pays signalent des nombres de cas records. Le variant Omicron du virus est beaucoup plus facilement transmissible que les autres. Et nous ne pouvons pas nous montrer complaisantes. Depuis le début de la pandémie, nous nous efforçons d'être souples et de nous adapter à la nature changeante de la pandémie. À l'intérieur de nos programmes, nous nous assurons de prévoir la marge de manœuvre nécessaire afin de réagir rapidement et efficacement. La semaine dernière, nous avons fait adopter le projet de loi C2. Cette loi a permis la mise en place de mesures ciblées pour soutenir les travailleurs et les entreprises si des confinements étaient nécessaires pour contenir la propagation du virus. Au mois d'octobre, lorsque nous avons présenté ces mesures plus ciblées, nous ne connaissons pas encore le variant Omicron, mais nous nous sommes assurés d'être prêts. Today, through regulatory authorities that were approved with the passage of Bill C2, we are announcing our decision to temporarily expand the definition of a lockdown so that these wage and rent support programs can support workers and businesses that see capacity restricted by 50% or more. So, what exactly does this mean? It means that if you are an employer who has to reduce the capacity of your main business by 50% or more, you will be eligible for wage and rent subsidy support through the local lockdown program. And we are lowering the revenue decline threshold from 40% to 25%. Eligible employers will receive wage and rent subsidy support from between 25% to up to 75%, depending on how much revenue they have lost. Your organization only needs to demonstrate revenue loss during the current month compared with 2019. Employers will be able to apply for these expanded support programs after the end of each program period in exactly the same way that they received wage and rent subsidy support when those programs were launched last year. For workers, our decision means that if you are working in a region where the provincial or territorial government has introduced capacity restrictions of 50% or more, and if you have lost 50% or more of your income as a direct result of those restrictions, you can qualify for the Canada Worker Lockdown Benefit. This benefit will put $300 a week in your pocket to supplement your lost wages. This proposed expanded eligibility will be effective as of last Sunday, December 19th, 2021, and it will run through to February 12th, 2022. Many parts of the country have already introduced circuit breaker public health restrictions in order to curb the rise in cases of COVID. These expanded federal support measures will ensure that provinces and public health authorities across the country can continue to make the right, difficult decisions they need to make to save lives, confident in the knowledge that the federal government will be there to financially support workers and businesses as we finish this fight. Notre gouvernement sait que d'autres entreprises sont encore touchées par la pandémie. Depuis hier, les employeurs admissibles peuvent demander une aide financière par le biais du programme de relance pour le tourisme et l'accueil et du programme de relance pour les entreprises les plus durement touchées. Ces programmes offrent des subventions salariales et d'aide au loyer pouvant atteindre 75% et 50% respectivement. Lorsque nous avons annoncé ces programmes En octobre, nous estimons qu'ils allaient coûter 7,4 milliards de dollars. La semaine dernière, dans la mise à jour économique et budgétaire, nous avons mis de côté un montant de 4,5 milliards de dollars en prévision de l'impact du variant Omicron. Le coût d'élargissement des programmes de soutien est estimé à 4 milliards de dollars et sera entièrement couvert par le montant prévu dans la mise à jour. And finally, let me add that public companies receiving the wage subsidy through these support programs that increase their top executive compensation in 2022 compared to 2019 will have this wage subsidy support clawed back. These companies will also become ineligible if they pay dividends while receiving the wage subsidy. So, as Dr. Tam reminded us last week, all pandemics do end. The emergence and the swift rise of Omicron is not something that any of us welcome. It's coming at a hard time, at a time when many of us, particularly our remarkable healthcare workers, are really, really tired. But I know that we can and we must do what it takes to beat this virus, to finish the fight against COVID. Canadians are smart. We are resilient. We support each other. And we have the tools we need, both healthcare tools and financial support measures to win this fight against COVID. With today's expanded federal support programs, Canadians can follow new provincial health restrictions, knowing that the federal government is there, as we have been from the start, to support everyone. Thank you. And let me now pass the mic over to my colleague, Minister Carla Qualtrough. Carla, please.
Merci. Thank you. Bonjour. Hello, everyone. J'aimerais vous parler brièvement de la façon dont nous soutenons les travailleurs canadiens face à cette crise de santé publique qui évolue rapidement. Nous avons constaté récemment une augmentation du nombre de personnes qui ont reçu un résultat positif au test de dépistage de la COVID-19 partout au Canada. Nous constatons une fois de plus que des régions et des provinces imposent des restrictions de capacité et, malheureusement, des fermetures complètes ou partielles. Ma propre province, la Colombie-Britannique, a annoncé des mesures pas plus tard qu'hier. If we've learned anything from this pandemic, we've learned that COVID-19 is unpredictable and we don't always know what lies ahead. But unfortunately, we know that we could be in a situation again where there would be new regional public health measures to help stop the spread of COVID-19. So when we introduced Bill C2, which included the Canada Worker Lockdown Benefit, we made sure we built in flexibilities so that we could be agile and make adjustments to support Canadian workers in their time of need. As we've been monitoring the public health situation, we've seen the need to expand the eligibility of the benefits for Canadians whose jobs are impacted by partial lockdowns or reduced capacity orders. That's why today we're making the necessary and temporary adjustments to the benefit to expand the definition of a lockdown order to include workers facing work reductions as a result of capacity restrictions of 50% or higher. Eligible workers could receive $300 per week if they've lost work as a direct result of a public health lockdown order. This Canada Workers Lockdown Benefit is in addition to the Canada Recovery Sickness Benefit and the Canada Recovery Caregivers Benefit, both which remain available to Canadian workers. We understand that Canadians may be feeling discouraged by the recent rise in COVID cases and new public health measures, especially at this time of year. And while the situation is evolving rapidly across the country, please be assured we'll continue to support Canadian workers as we've done throughout the pandemic. I'll leave it there and I'll pass it on to my colleague, Minister Duclos.
Merci beaucoup, Carla, et bonjour à tous et à toutes. C'est avec grand plaisir que je me joins à vous de façon virtuelle aujourd'hui. Thank you for being here. Today, I want to provide you with a brief, quick update on the current COVID-19 situation. Even though we had all hoped that this holiday season would look very different than what it does, there are still many reasons to be optimistic. Vaccines for adults and children are widely available, as well as booster doses, thanks to the largest vaccination program in Canadian history. As we end this year, over 80% of eligible Canadians are indeed fully vaccinated. Du 19 novembre, date à laquelle Santé Canada a homologué le vaccin de Pfizer pour les enfants de 5 à 11 ans, jusqu'au 11 décembre, 32% des enfants de 5 à 11 ans au Canada ont reçu une dose de vaccin, le tout en seulement 3 semaines. Voilà des réalisations remarquables. Nous serions dans une situation beaucoup plus difficile au pays si nous n'avions pas des taux de vaccination aussi élevés. Je veux donc, et tout d'abord, remercier tous ceux et toutes celles qui se sont déjà fait vacciner cette année. Maintenant que les doses de rappel sont disponibles pour le plus grand nombre, je vous encourage toutes et tous à prendre votre 3e rendez-vous si ce n'est pas encore fait. Being fully vaccinated and then getting a booster, whether Pfizer or Moderna, will help provide protection against infection and illness. On this particular point, let me be very, very clear. As soon as you're eligible, whether it is Pfizer or Moderna, you should take the first booster dose available to you. If you have yet to be vaccinated, it is not too late. Every additional vaccinated person helps support our defense against COVID-19, as well as protecting personal health and safety. The Government of Canada continues to work closely with provinces and territories and public health partners to accelerate the rollout of booster vaccination campaigns. Close to 5 million Canadians have already received their booster doses. Nous avons également en stock suffisamment de vaccins à ARN messager pour administrer plus de 22 millions de doses de rappel partout au pays. Des millions d'autres doses seront livrées au cours des prochaines semaines et des prochains mois. Les stocks de doses de rappel sont suffisants pour offrir une dose de rappel à toutes les personnes admissibles au pays, que ce soit des vaccins Pfizer ou Moderna, ils sont tous les deux sûrs et efficaces. Permettez-moi d'insister, dès que vous êtes admissible, qu'il s'agisse de Pfizer ou de Moderna, vous devriez prendre la première dose de rappel disponible. The Government of Canada also continues to work closely with provinces and territories to increase access to rapid testing supplies across Canada. As you may be aware, each province and territory determines its desired approach for testing, screening, and surveillance, as they are responsible for the delivery and administration of healthcare services. We are making sure that our distribution strategy ensures equitable access to rapid tests for Canadians all across the country. As a screening tool, rapid testing provides another layer of protection against COVID-19, along with many other public health measures, such as mask wearing, hand hygiene, physical distancing, proper ventilation, and obviously vaccination. Rapid tests are able to identify individuals who have a high viral load, despite the test's lower sensitivity compared to a molecular PCR test. Des résultats rapides signifient une intervention rapide, mais il est crucial de se rappeler que ces tests ne sont pas parfaits. Si vous obtenez un résultat négatif, continuez d'être prudent en présence d'autres personnes, puisque vous pourriez être au premier stade de l'infection et pourriez donc infecter aussi les autres. Si vous obtenez un résultat positif, il est crucial de vous isoler et de suivre les conseils de santé publique de votre localité. Sur la livraison des tests rapides, la majorité des 35 millions de tests rapides commandés par les provinces et les territoires pour le mois de décembre ont déjà été livrés. Les tests restants seront reçus avant la fin du mois et des dizaines de millions de tests additionnels arriveront en janvier et en février. We're also continuing to expand the distribution of rapid tests across Canada. In time for the holidays, we're further working with the Canadian Red Cross, who will partner with community organizations, including food banks, to distribute rapid tests to Canadians who use their services. In conclusion, I will urge you to continue to be prudent and responsible this holiday season. Please take responsibility for your health and the health of others by following the advice of local public health officials. Restez en sécurité et restez prudent. Faites-vous vacciner si vous ne l'avez pas encore déjà fait et si vous y avez droit, recevez votre dose de rappel. C'est évident, et on l'a vécu l'an dernier, les fêtes de fin d'année sont un moment propice à la transmission du virus. Ce sont les gestes que nous poserons individuellement dans les prochains jours qui détermineront notre sort dans les prochaines semaines. Et je cède maintenant la parole à la Dr Tam et au Dr Njoo.
Bonjour à toutes et à tous. So in less than a week, we've seen a rapid acceleration of epidemic activity in locations across Canada. While Delta is still spreading in many areas, Omicron is increasingly responsible for rapid rise in case counts. With over 2,360 confirmed Omicron cases to date, this new variant is now predominating in several locations across Canada. Compared to a national average of over 5,000 new cases being reported daily by the end of last week, there were over 11,300 new cases yesterday alone. Modeling shows that by the beginning of January, we could have very high number of cases, which underscore the need to act urgently now to reduce the acceleration. At the moment, severe illness trends are increasing in the most heavily impacted provinces, which has begun to shift the national trend. Over the past week, on average, over 1,500 people with COVID-19 were being treated in our hospitals each day, with close to 460 in intensive care units and 17 deaths were reported daily. Although the current trends may be a lagging impact of increased Delta activity in the preceding weeks, rapid acceleration of Omicron activity is expected to further impact these trends as well, even if Omicron turns out to be less severe. Because we're especially worried about the potential impact of a sudden and strong surge on the healthcare system, we're urging all Canadians to do what they can to help mitigate this. Although the situation is not the same everywhere, this variant spreads extremely quickly, and the situation can rapidly get out of hand anywhere. So while public health authorities are closely monitoring the evolving situation, we can all help by reducing our contacts as much as possible. Practically speaking, this means keeping gathering sizes as small as possible, such as limiting to just family and close friends who you know well. Everyone who's eligible should get fully vaccinated and receive a booster dose as soon as they are able. And everyone should use layers of protection, since no measure is perfect or applicable for all people. In particular, we can reduce the risks of exposure and spreading the virus by improving and maintaining good ventilation and wearing a good quality and snug-fitting face mask, while remaining flexible if plans need to be adjusted at the last minute. Currently, we'll still need many more people to increase their protection with COVID-19 vaccines. Over 7 million eligible Canadians need a first or second dose of the primary series, and many more are eligible to get a booster dose to help restore protection that may have waned since their second dose. Booster doses of either Pfizer or Moderna mRNA vaccine should be prioritized for certain groups, such as healthcare workers and those at highest risk of severe illness from COVID-19, including older adults and people with high-risk medical conditions. Although we're all dealing with some disappointment and changed or disrupted plans, I hope we can all agree that we're doing what we need to do for all the right reasons. Beyond taking extra precautions to safeguard our health and the health of our family and friends, we're also adjusting to safer plans in order to safeguard our health system and get everyone through this difficult time that much faster. We've said this before, but I want to especially acknowledge our healthcare and public health workforce. They have been there for us and have made daily sacrifices that many of us can only begin to imagine. Now that they are facing what could be the largest and most sudden impact to date, At any time when they're arguably at their most exhausted, they need to know that we're all doing everything we can to minimize the threat before us all. These are not the holidays we wish for, but it doesn't mean that we're back where we started. We have more and better tools in our toolbox, including vaccines and booster doses, better knowledge of transmission and enhanced guidance on individual protections, as well as more testing options and improved clinical management and treatments. For the coming weeks, we have to work to these strengths and keep working together to clear this hurdle. Thank you. Merci, Megwitch.
Bonjour à toutes et à tous. En moins d'une semaine, nous avons assisté à une accélération rapide de l'activité épidémique dans plusieurs régions du Canada. Alors que le variant Delta se propage toujours dans de nombreuses régions, le variant Omicron est de plus en plus responsable de l'augmentation rapide du nombre de cas. Avec plus de 2360 cas d'Omicron confirmés à ce jour, ce variant est maintenant prédominant dans plusieurs régions au pays. Alors que la moyenne nationale était de plus de 5000 nouveaux cas signalés quotidiennement à la fin de la semaine dernière, on comptait plus de 11 300 nouveaux cas pour la seule journée d'hier. La modélisation montre qu'au début de janvier, nous pourrions avoir un très grand nombre de cas, ce qui souligne la nécessité d'agir de toute urgence pour réduire l'accélération. À l'heure actuelle, les tendances des cas de maladies graves augmentent dans les provinces les plus touchées, ce qui a commencé à inverser la tendance nationale. Au cours de la semaine dernière, en moyenne, plus de 1500 personnes atteintes de la COVID-19 ont été traitées chaque jour dans nos hôpitaux, dont près de 460 dans des unités de soins intensifs et 17 décès ont été signalés chaque jour. Bien que les tendances actuelles puissent être un effet retardé de l'activité accrue du variant Delta au cours des semaines précédentes, l'accélération rapide de l'activité du variant Omicron devrait également avoir des répercussions sur ces tendances, même si le variant Omicron s'avère moins grave. Nous sommes particulièrement inquiets des conséquences potentielles d'une forte et soudaine recrudescence de la maladie sur le système de soins de santé. C'est pourquoi nous demandons vivement à tous les Canadiens de faire ce qu'ils peuvent pour atténuer ces conséquences. Bien que la situation ne soit pas la même partout, ce variant se propage extrêmement rapidement et la situation peut très vite devenir hors de contrôle n'importe où. Alors que les autorités de santé publique surveillent de près l'évolution de la situation, nous pouvons tous contribuer à réduire nos contacts le plus possible. En termes simples, cela signifie restreindre la taille des rassemblements le plus possible, par exemple en se limitant à la famille et aux amis proches que l'on connaît bien. Toutes les personnes admissibles devraient être entièrement vaccinées et obtenir une dose de rappel dès qu'elles le peuvent. Et chacun devrait utiliser plusieurs couches de protection car aucune mesure n'est parfaite ou applicable à tous. En particulier, nous pouvons réduire les risques d'exposition au virus et de propagation du virus en améliorant et en maintenant une bonne ventilation et en portant une masque de bonne qualité et bien ajustée, tout en restant flexible s'il faut changer les projets à la dernière minute. À l'heure actuelle, nous avons toujours besoin que beaucoup plus de personnes augmentent leur protection avec les vaccins contre la COVID-19. Plus de 7 millions de Canadiens admissibles ont besoin d'une première ou d'une deuxième dose de leur série primaire et beaucoup d'autres sont admissibles à une dose de rappel pour aider à rétablir la protection qui a pu s'affaiblir depuis leur deuxième dose. Les doses de rappel des vaccins à ARN messager de Pfizer ou de Moderna devraient être administrées en priorité à certains groupes comme les travailleurs de la santé et aux personnes les plus vulnérables aux maladies graves causées par le COVID-19, notamment les personnes âgées et les personnes atteintes d'affections à haut risque. Bien que nous ayons tous à faire face à une certaine déception, à une réorganisation de nos projets, j'espère que nous sommes tous d'accord pour dire que nous faisons ce que nous devons faire pour les bonnes raisons. En plus de prendre les précautions supplémentaires pour préserver notre santé et celle de nos proches, nous adaptons nos projets afin de protéger notre système de santé et de permettre à chacun de traverser cette période difficile beaucoup plus rapidement. Nous l'avons déjà mentionné, mais je tiens à remercier tout particulièrement nos travailleurs de la santé et de la santé publique. Ils ont été là pour nous et ont fait des sacrifices quotidiens que beaucoup d'entre nous ont peine à imaginer. Maintenant qu'ils sont confrontés à ce que pourrait être ce jour la plus grande et la plus soudaine des répercussions, à un stade où ils sont sans doute le plus épuisés, ils doivent savoir que tout le monde contribue à réduire autant que possible la menace qui pèse sur nous tous. Ce n'est pas les vacances des fêtes que nous souhaitons, mais cela ne signifie pas que nous sommes revenus au point de départ. Nous disposons d'outils plus nombreux et plus efficaces, notamment des vaccins et des doses de rappel, une meilleure connaissance de la transmission et de conseils plus précis sur les mesures de protection individuelle, ainsi que d'un plus grand nombre d'options de dépistage et d'une meilleure gestion clinique et de traitement. Au cours des prochaines semaines, nous devrons nous appuyer sur ces outils et continuer à travailler ensemble pour franchir cet obstacle. Merci. Thank you. Miigwech.
Thank you. We'll now move to questions. Just a reminder, one question, one follow-up, and heads up that the Prime Minister can take questions for 20 minutes. The other ministers and the doctors will stay after that. Thank you. So, operator.
Thank you. Merci. For questions, please press star 1 on the device's keypad. Pour toute question, faites étoile 1 sur votre appareil. The first question is from Mike Lecouteur from Global News. Please go ahead. Your line is open.
Thank you for taking our questions. Prime Minister, if you forgive me and permit me a bit of a double-barreled question, since you gave us a bit of news, seeing that you said some of your staffers and member of your protective detail have tested positive. So on the first side, I wanted to know, have you taken a PCR test or rapid test to check your status and share that with us? But also, many Canadians are having these difficult conversations with their family ahead of Christmas. So what was the conversation like in your household with your kids and family, seeing as how you likely had to change how your holiday plans will play out?
Thanks, Mike. First of all, we are following all public health guidelines every step of the way. The members of my staff and detail who have tested positive are following public health guidelines, as am I, as are everyone. I have been taking rapid tests, so far negative, but following public health guidelines, I'm being careful about everything that I do, which is part of the reason why we're in virtual today. Secondly, a lot of people are having very difficult conversations. Nobody wanted to be in here right now in this situation. We were looking forward, now that 80% double vaccinated in Canada, we were looking forward to a bit of a respite, a time to gather as families and friends at the holidays and celebrate what looked like perhaps the beginning of the end of COVID. And then Omicron came and changed that for everyone. And nobody wants to be in this situation. But we know what to do, Mike. And yes, there have been lots of conversations about not seeing friends, not gathering for New Year's, not gathering outside of immediate family for Christmas in our household, like in a lot of households. But quite frankly, there's a lot of people for whom those conversations around having more restricted holiday gatherings are still better news than what a lot of Canadians are facing. People who will be totally alone for Christmas, people who are facing significant health challenges, people who are dealing with mental health issues that have been exacerbated by the past 2 years of extraordinary difficulty. Most of us will just have a slightly smaller number of gatherings and contacts through these holidays, which we'll survive through, won't be all that great. But let us think of those people who are working in our hospital rooms, in our critical care facilities, out there giving vaccinations and boosters, and continuing to do everything they can to keep us safe, for whom this holiday will be more difficult and, quite frankly, will determine just how difficult the entire winter will be.
And just as a follow-up, when you talk about the announcement of the expansion of the benefits, things have been moving very quickly, probably more quickly than we have at any point during this pandemic, but it's also not our first wave. How is it that some feel that we're still behind the eight ball here, we're playing catch-up with Canadians not being able to access the programs they need in the timely fashion they need, because a lot of people feel like they saw this coming, but the benefits weren't there yet?
We saw this coming. We saw the potential for this coming, which is why we put forward Bill C2, Bill C3 measures to support people. We are glad it got passed at the very end of the parliamentary sitting. We would have liked it to have been passed earlier, but having been passed now, we're able to adjust the regulations a little bit so as where it was created in case of localized lockdowns, that there be supports. Now we're expanding it so that it's there for places with reduced capacity. So we have the measures in place. Sure, we would have liked to have been able to pass them quicker in this Parliament, but as you know, Mike, Parliament moves at its own speed, but at least they are in place now so we can be delivering those supports to Canadians as quickly as possible.
Thank you. Merci. La prochaine question nous vient de Boris Proux, Le Devoir. À vous la parole.
Bonjour. Question très simple. Est-ce que l'élargissement de l'accès aux aides aux entreprises s'applique maintenant aux entreprises qui ont été créées durant la pandémie?
Très bonne question. Je vais passer la parole à la vice-première ministre.
Monsieur le Premier ministre, la réponse est non. On utilise la même plateforme, les mêmes règles qu'on a utilisées pour les subventions salariales et les subventions pour le loyer. Alors, ce sont des programmes pour les entreprises qui étaient là avant le début de la pandémie, les entreprises qui étaient créées quand personne ne savait qu'on aura cette expérience de la lutte contre une pandémie.
Merci. En suivi, qu'est-ce qui est prévu pour ces personnes à qui on a demandé de se renouveler et qui se sont lancées en affaires? On a parlé à plusieurs personnes là, qui se sentent complètement démunies de ne pas pouvoir bénéficier d'aide. Qu'est-ce que vous leur dites finalement à elles qui ne sont toujours pas admissibles à ces nouveaux programmes d'aide?
Je dirais premièrement que, comme le Premier ministre a juste expliqué, la chose importante de constater, c'est que le Canada est prêt, que même en octobre, quand personne ne savait ce qui était Omicron, on a compris que c'était nécessaire d'avoir une police d'assurance. On a compris que la lutte contre la COVID n'était pas finie et que ce sera nécessaire d'avoir les outils pour répondre en manière très vite à une nouvelle vague de la COVID. Et c'est ce qu'on a fait, commençant en octobre, et ce sont les nouvelles mesures qu'on a annoncées aujourd'hui. C'était toujours le cas que oui, on est là pour les entreprises, on est là pour les gens, on est là pour soutenir l'économie, mais on doit avoir une approche qui a de l'intégrité. On doit avoir les données avec lesquelles on peut faire une comparaison. Et nous trouvons que l'approche la plus juste, c'est d'avoir une approche qui a une comparaison avec les revenus qu'on a maintenant et celles qu'on a eues devant le début de la pandémie.
Thank you. Merci. Next question is from Mackenzie Gray from CTV News. Please go ahead. Your line is open.
Hello, Prime Minister. In Ontario and a number of other provinces right now, the testing system has essentially collapsed. There's multi-day ways to get a PCR test. People are lining up at 5 o'clock in the morning even to get a chance to get a rapid test. And for boosters right now, it's basically Hunger Games to try and get a shot. We're 2 years into the pandemic, basically. So how is Canada in such a terrible position right now?
Well, first of all, Mackenzie, on rapid tests, as of the beginning of December, we'd sent out 85 million rapid tests to provinces and territories. That's over the past year. Not all of them had been used, and there were many stockpiled. We're delivering more rapid tests now, 35 million throughout this month, with tens of millions more. There are provinces and territories, I think of particularly Nova Scotia, that has been doing an exemplary job of using rapid testing in communities, in commercial businesses, sharing them with Nova Scotians in a way that has allowed for a regular monitoring of people's conditions. Other provinces are now starting to do that, which is a good thing. The federal government, as we promised to, is procuring millions upon millions, over 100 million rapid tests and sending them to the provinces. All told, we will be doing more to make sure that rapid tests are getting out there for people. It is a matter of provincial and territorial distribution to get those rapid tests into people's hands so that they can use them. In regards to boosters, when we signed our vaccine agreements, we updated them with advanced purchase agreements for vaccine doses, tens of millions of vaccine doses into 2022, into 2023, and indeed beyond. That's why we are in such good situation right now in terms of boosters. We have enough boosters in Canada for everyone who is eligible to go get themselves boosted, to get themselves fully vaccinated. Obviously, there are pressures on distribution, on getting those into arms as quickly as possible, and provinces are in charge of that, but we will, of course, look to be helpful in any way. But in terms of booster supply, the federal government is there.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.